Welcome to the Natural Health and Healing Show with one of New England's leading nutritionists, Mark Mincola. The show is brought to you by the Good Health Stores in Hanover and Quincy. Call Mark at 781-837-4900 with your health and nutrition questions. Now, here's Mark.
Good evening and welcome. Good evening and welcome. How about if I use the right mic? I've only been doing this for 7 years. Come on, give me a break, will you? Anyway, welcome everybody. Great to have you here tonight, and we're going to have a very interesting conversation this evening with a real pioneer, real leader in alternative medicine and basically family practice, environmental medicine, a physician who's worked a great deal with Lyme disease, multiple chemical sensitivity, autism, someone who is very clearly aware of what live cell analysis is. For those of you who are familiar with that, there are very few physicians out there that really are on the cutting edge and who really understand the work of Enderlein, the pleomorphic work and the research of Enderlein and the live cell analysis, which is really very popular in Germany, very popular in Europe among a lot of the physicians in Europe, but most of the folks in the United States are not familiar with it. Most of the medical people here are not. We're going to meet this evening with Dr. Jean Hubbock. Dr. Jean Hubbock, who again specializes in family practice and environmental medicine. And she's located up on 288 Walnut Street up in Newton, Mass. And again, she is somebody who has a great deal of remarkable information and a lot of passion about being a medical doctor who has a bent on alternative practice, and she certainly practices homeopathy. She utilizes a great deal of nutritional supplements and diet with her programs. And she's a terrific, terrific person, and I know you're going to enjoy hearing from her. And she, again, has worked a great deal with many, many folks in the New England area and really throughout the nation with conditions that are rare conditions for those folks who are seeking alternative medical care. She runs a series of very interesting blood tests and has some remarkable procedures that we're going to talk with her about this evening. So I know you're going to be interested in what she has to say, and again, she is a cutting-edge leader as far as really understanding the ins and outs of alternative medicine and medical practice. So she's going to basically give us the lowdown here on exactly what's going on in her part of the world and her practice. And I think we've got her on right now. Jean, are you there? Dr. Hubbock?
Yes, I am.
Welcome.
Yes, I am. Good evening.
Great to have you on board.
Well, thank you. Great to be here.
Great to have you on. And we'd like to talk a little bit about your specialties, of course, family practice, environmental medicine. A lot of folks out there certainly know what family practice is, Dr. Hubbock, but what exactly is environmental medicine for those who do not know?
Well, environmental medicine is the discipline that's really looking at the person in relationship to their entire environment. So you're talking about the air that we breathe, the food that we eat, the chemicals that we may come in contact with either through air or through food, other types of more traditional allergies, pollens, that type of thing. So it's really looking at the person in relationship to everything we come in contact with.
And, of course, terms like environmentally intolerant or multiply chemical sensitive, these are terms that are fairly new on the medical horizon, but they certainly have great relevance in your practice and in your world. And why is it, do you think, that so many people suddenly are unfortunately contending with these problems that, for years and years no one even heard about, no one suspected, or very few people may have suspected, but it seems to be really on the rise right now, multiple chemical sensitivity. Why do you think that is?
Well, I think it has a lot to do with our relationship with the environment and how many new chemicals have been introduced into the environment. There are upwards of 100,000 different chemicals that are introduced and that are existent in the environment right now. And while there are safety studies for an individual chemical, there's really never been any studies that look at what happens when you're exposed to multiple chemicals, which of course we all are.
Mm-hmm.
You know, from just the things that we bring into our homes with the different pesticides that may be on the food, with the plastics that we bring into our home that have different outgassing properties, as well as things like heavy metals. So I think it's the multitude of things that are now in the environment, and the fact that people's diet in general has become much less whole foods. It's much more processed foods, things that are either frozen in a can, fast foods, microwaves, which changes the different vitamin and mineral structure a bit. So I think when you add all these things together, it just takes, for some people, it's a particular insult that happens that is the onset of their chemical sensitivity. Like they can tell you they got the floors refinished in their house in the wintertime when the house was closed up, and that was the onset of their beginning to react to multiple things. Or for some people, it's an exposure that happens at work in a closed building where there's not good ventilation, and there may either just be the chemicals that are outgassing from the furniture, or it could be that there's mold in the ventilation system, and they have what's called sick building syndrome, and that may be what initiates the event. But once something starts, then people can become allergic to many more things. So there's often an initiating event, but then there is a extensive, it just changes and expands from there.
You know, in my first book that I finished in 1989, a book entitled The Wu Wei, I used a term, de-evolution, and I said that I felt that we were kind of entering into this zone of de-evolution that was going to really spell a lot of problems, a lot of dangers for the human body. And I think the environmental intolerance, the multiple chemical sensitivity are sort of signposts of that very thing that I had in mind. Would you say, Dr. Hubbock, that the human body in general, it's a generalized statement, but I'd still be interested in your comment. Do you believe that the human body is less healthy than it was 20 years ago, 40 years ago, 100 years ago?
Probably, certainly 100 years ago. I think there's, a lot more probably autoimmune diseases and other types of illnesses that didn't really exist much 100 years ago.
Right.
In the last 100 years, we've had the huge introduction of sugar, processed sugar. 100 years ago, people were not eating pounds of sugar.
Right.
And now it's very common, for individuals to eat up to 50 pounds a year per person. And that doesn't even go into the artificial sweeteners or the high fructose corn syrup, which seems to be particularly problematic in terms of onset of the way that your sugar is metabolized and the onset of adult-onset diabetes and metabolic syndrome.
Yep. Is it getting, do you think it's getting tougher to be a physician with all of these complexities?
Well, in some ways, I think it's getting more interesting because we're now, I think there's so much in the functional medicine and in the whole person evolution of looking at health and development, then I think in some ways we have a whole lot more tools open to us than we did 30 years ago.
Sure. Yeah.
And different ways of understanding what's going on in the body in terms of health and disease, and trying to really maintain health and maintain functionality throughout the main years of one's life so that one doesn't become disabled for 20 or 30 years before one dies.
Right. What about there's an incredible rise in Lyme disease. All of a sudden we're hearing so much about Lyme disease every year now, and even through the year, even through the winter months. What say you about the rise and the peculiarities of Lyme disease?
Lyme is a really interesting problem, and it's particularly present in the coastal areas in New England. And it's complicated because it's very difficult to diagnose often, and the treatments are not easy. And that's because it's a spirochete. It's a particular type of organism that is can lose its cell wall and still exist. So a lot of the antibiotics and treatments just hit the cell wall. Well, this organism is very happy without a cell wall. It can still reproduce, and it can also form a cyst. So I don't know if it's so much, it may be the changing in the climate and just the warmer winters. It seems like the ticks have really spread from the south way up into the north. A few years ago, there really weren't ticks in Maine and Vermont and some of the northern states, and now they've been seen up in all of those states. So it's really moving north. And I think they're just, unfortunately, Lyme disease is, it's a little bit of a political diagnosis at this point.
It really is.
Real different positions on chronic Lyme. There's not a whole lot of disagreement on treating acute Lyme.
Correct.
Although a lot of people aren't educated, a lot of doctors and health aren't educated enough to know that you don't always have to have a bullseye. In fact, it's present in less than 50%, and that many people, often less than 50%, actually see the tick. So you have to be very suspicious of the constellation of symptoms if someone's outdoors and in an area where they could get Lyme.
Well, and the other question, of course, is that I know a lot of people are interested in, is it possible for someone to test positive for the Lyme titers and really never have been bitten by a Lyme tick?
No. If the Western blot, if you're looking at the bands that are highly specific to Lyme, now there are some bands on that Western blot that many things can cause to be positive. So those bands, yes, can be positive if you've not been exposed to Lyme. But the ones that are highly specific for Lyme, I think if those bands are positive, it certainly tells us that a person has been exposed to Lyme at some point in their life.
Right.
Some of those bands, the IgGs, the long-term antibodies, could stay positive lifelong. We don't know how long they stay positive. So you can't necessarily tell by that whether it's an acute infection now or something that someone had in the past.
And one of the other confusing things about Lyme disease is there are folks out there who, for example, were exposed to a Lyme tick early in life, during perhaps childhood or in their younger years, and then were fine for 20, 30 years, and then their immune system kind of took a dip. And because of that chronic IgG profile you just mentioned, they can then find themselves being taken ill again 20, 30 years later. That's certainly possible.
So like so many things, the immune system is really the key.
Right.
In terms of viruses and things like spirochetes.
Right. And I know you've worked a great deal with folks with autism, and I know there's an awful lot of families out there that listen, a lot of parents, of course, out there that are always interested in hearing some different perspectives and some enlightening information regarding autism. I know you've worked with folks with autism. Let me know your thoughts about autism as well.
Okay. To me, the situation with autism is really similar to finding the canary in the coal mine. I think these are the children who are very sensitive to different onslaughts, whether they're chemicals, toxins, nutritional situations. There's definitely been a huge increase in autism over the last 25, 30 years. To now as much as 1 in 150. And I think certainly the number of vaccines has greatly increased over the 30 years that I've been in practice. When I was first in practice, there were maybe 10 vaccines that we gave, and now there are upwards of 30. And some, like the hepatitis B vaccine, was being given at birth, which is a big onset, for an infant to handle. And up until the last number of years, that hepatitis B vaccine also had 25 micrograms of mercury in it. So to get 25 micrograms of mercury at day 1 and again in a month and then at 6 months is a huge dose for an infant, given their weight. It's enough to contaminate a whole lake. So those are the things that I think are feeding into it. there seems to be a real sensitivity, often in the digestive system, of a lot of the children with autism, and there's a huge response to a gluten and casein-free diet. That's one of the medical interventions that has been hugely, just profoundly successful in many of the children. And it probably has to do with their inability to break down the proteins that make up those two foods. So gluten is wheat, rye, and barley, and casein comes from all the cow dairy products. And those peptides can circulate in the blood system and get into the brain and really make it so that it's very difficult in terms of having one part of the brain talk to another. So it's just another one of the kind of imbalances that can happen in the autistic spectrum.
We are talking with Dr. Jean Hubbock. Dr. Jean Hubbock is a family practitioner and an environmental medicine specialist. She has offices in Newton, Massachusetts, and we're going to get back and talk with her right after these messages. Stay right where you are.
Hi, this is Laura from Good Health. Here's the thing. Why burn precious gas driving all over town to find what you need, only to spend more than you have to? At Good Health, you'll find it all. Clean, organic produce, natural groceries, vitamins, beauty items, and your holiday gifts. It's not rocket science. At Good Health, we keep it real. Great products at low everyday prices. Simple and easy. Come by and see what I mean. Thanks for tuning in.
Right in our area, we are fortunate to have one of the top martial arts schools in the country, Personal Best Karate. Personal Best has been recognized for their community involvement, professional staff development, character building programs, and exciting educational curriculum. Personal Best stands at the top of their industry. 5 locations offering personalized professional instruction. Not sure if karate is right for you? At no obligation, the staff at Personal Best will guide you in a private introductory program to see if karate is indeed the right fit to help you achieve your goals and meet your needs. What does karate at Personal Best teach you? Character building, success habits, helps you get in shape, relieve stress, self-control, setting goals, and of course, self-defense. Personal Best's goal is to create successful, contributing members of society through the practice of the martial arts at Personal Best. Mr. Chris Rappold is, of course, the founder of Personal Best Karate. He tells me his greatest joy of all is to see the personal transformation in each and every student. Bring out your best with Personal Best Karate. Telephone number 508-285-5425. That's 508-285-5425. Locations in Norton, Foxborough, Southeaston, Franklin, and Taunton. That's Personal Best Karate. Alrighty, welcome back. We're having a conversation with Dr. Jean Hubbock, and Dr. Hubbock is, of course, a family practitioner, environmental medicine specialist, and really does a wonderful job with regards to alternative approach to medicine. Her offices are in Newton, 288 Walnut Street. Telephone number there is 617-965-7770. Dr. Hubbock, when someone visits your office, has an appointment with you, tell us a little bit about what happens.
Well, I have new patients fill out an extensive history form ahead of time, and then I spend an hour and a half with them going over their story, essentially. And I find it really helpful to know when they deviated first from health into going down a pathway that leads to symptoms and problems. Mm-hmm. And often by really taking a careful history, I'm able to figure out some of the causative factors and then help come up with some solutions.
And there's an extensive array of possible blood work and various tests that you can run. I know that. I know one of the things that I wanted to talk with you about this evening is the live cell testing.
Yes, live cell testing is very interesting. I really became introduced to that through doing biological medicine with Dr. Rao from Switzerland, which I've done over the last 7 years. And the live cell is a technique by which the blood is looked at under a dark field microscope so that you're actually seeing the living blood and watching it evolve and change as it's exposed to heat and temperature that's really different than being in the body. So it's the stress of being taken out of the body, put on a glass slide, smushed under the cover slip, and then looked at, helps the blood start changing. And you can really tell a lot in terms of your reserve and whether there's more tendency toward the blood being excessively sticky or clumping together, and how the white cells are working. The white cells are basically your defense system. They really help gobble up pathogens, bacteria, spirochetes. So you can see whether they're active and really able to do their job, or whether they're full of toxins and hardly moving.
Right.
So the live cell is a real glimpse into life right now.
Right. It's amazing. It's you can actually see, as you point out, bacteria. You can see viruses. You can actually see in real living time what your blood environment looks like on a slide. It's truly remarkable. Yeah,
it really is. And I mean, you can't diagnose specific infections, but
correct.
You can tell how your body is responding to those, and you know what kinds of supports you can give the body to help it do a better job.
Well, and you can see what the terrain of the body looks like. And I know that there's a tremendous amount of wonderful work that Dr. Enderlein has done over the years regarding pleomorphism and the whole philosophy of pleomorphism. That the blood is ever changing, and of course, what isn't in the world of nature? Everything in the universe is constantly changing, including the world of our blood. And he talks about what kind of changes, as you just pointed out, a physician might look for in this live cell analysis. So it really does give you a very different perspective of the terrain and what kind of changes one's body is going through, and what kind of tendencies for, as you say, not specific diagnostics, but tendencies toward problems and patterning of problems may be visible in some of this live blood cell analysis. So do you do live blood cell commonly with folks? If folks come to see you, you do live cell work with people, yes?
Well, here's the interesting thing in Massachusetts is that medical doctors are not allowed to do live cell without it being a complex laboratory. So I don't actually do it. I refer it to someone else who can do it.
I see.
But I think the live cell is a very important study that we have in order to look at the body. It's a great tool. I mean, the other tests that we have, there are functional tests that can look at digestion, where you can look at the stool and see how things are absorbed, whether there are the good balance of the lactobacillus and bifidobacteria, the good bacteria versus more pathogenic bacteria, and how whether the fats are being absorbed or whether they're showing up in the stool. So that's a good functional test for the digestive piece.
Yep.
And then there are blood tests that look at minerals, vitamins, some of the functional markers for vitamins. There's also tests that can be done that are a whole series of them that are really a functional test for vitamins, antioxidants, minerals. That gives a different window on the body.
Right. Now, you mentioned a term just a few moments back that a lot of people may not be familiar with regarding the work you did with Dr. Rao, biological medicine. Explain.
Well, biological medicine is the term that's being used to look at, again, a person in relationship to everything that they eat, breathe, how they're responding to the stressors in their life, and it really the goal of it is really bringing the body back into balance. And the tests that are used to identify what are going on is not only the standard kind of medical test, but also the live cell, the digestive look, something called computer-regulated thermography, which looks at how the different organs in the body are regulating or how they're blocked. You look at heavy metals. One can look in the hair or in the urine or stool for excess levels of heavy metals. And then there are things that are done really to help the body come back into balance. So it's really felt that health is a state of balance and disease is a state of imbalance.
Absolutely.
And
right.
the biological medicine is trying to use diet, exercise, breathing, stress reduction. A lot of the homeopathics, particularly the ones that are based on Enderlein's work that you were talking about, the pleomorphic and heal remedies that rebalance the body, and different detox things, like the detox treatments are sauna, where you're sweating. There's some foot bath that helps detox through the feet. Colonics are sometimes used as a way to, again, do some detoxification.
And would you say that in general, the Europeans seem to be more interested in embracing the notion of biological and holistic type medicine?
I think they're quite ahead of us in that. So yes, I think they are, but I think we're catching up.
Yeah, I think we are. There's no question, though, that the Germans, the French, even the Italians, I think they've made remarkable strides with biological medicine in the last 10 years.
Yes, they're really, approaching it. Because here's the difference. In our system of medicine, we put all the emphasis on a diagnosis. Mm-hmm. Everything is about figuring out what disease the person has. And in biological medicine, the diagnosis isn't really important. It's looking at the imbalances in the body and trying to rebalance them and let the body heal itself, regardless of what the label is. The label is really not so important. And that's a really big difference. So instead of what disease does the person has, it's what kind of a person has a disease.
Very true. And also, we live in a country where we've got a $1.9 trillion healthcare budget and only 1% is dedicated to prevention. So there's not a whole lot of focus on really educating and empowering people how to make a difference in their day-to-day lives in terms of prevention of disease.
No, and I think everything in this society is geared toward just finding a quick solution.
Yep.
Let me give you a pill that'll take care of your hypertension. Let me give you a pill that'll take care of your cholesterol. So you don't really have to change your lifestyle or your diet or anything that you're doing. We'll just give you a pill and it'll all be better. And what we're really finding is that, in essence, that can only work up to a certain point.
Right.
And after that, it's a failure. And that really changing the underlying piece is what I think really keeps people healthy.
It's nature's way of saying, guess again.
Right.
We are talking with Dr. Jean Hubick, and she's a family practitioner, environmental medicine specialist from Newton, Massachusetts. And we'll join her once again in just a few moments. We're going to take a very short break. Stay right where you are.
This is Catherine from Jarrow Formulas. We're happy to have continued our relationship with Mark Mincola in the Health and Healing Show, and we're happy to announce a new product from Jarrow Formulas called Jarrow Cell. We all know that as the body ages, it heals less rapidly and becomes frailer. Often the body is unable to process enough nutrients to repair weakening cartilage and protein fibers. A very important element in building and repairing your body is silicon. But unfortunately, as we grow, you may have difficulty absorbing adequate silicon from your diet. But now, thanks to a product called Jarrow Cell, you can be sure to get your share. Jarrow Cell can give you the silicon you need to support your bone health, bone mineral density, and in addition, Jarrow Cell strengthens and beautifies your hair, skin, and nails. Jarrow Cell is available now in a synergistic liquid formula that also includes boron and zinc. Ask for Jarrow Cell at your local health food stores. Or for more information, you can go to the Jarrow website, which is www.jarrow.com.
Hi, this is Laura from Good Health. We're all about smart, simple nutrition. Let us help you keep your resolutions and achieve all your personal goals. Lose weight, feel better, and look your very best today. Thanks for listening to the Health and Healing Show. We hope to see you soon.
All righty, welcome back. We will join Dr. Hubbock again shortly, but right now it's time for us to talk for a moment or two with Candida.
Ta-da!
How are you?
I'm sick, actually.
No, you're not. Never say that. Never say that. Come on now.
You'll have to muscle test me after the show, please.
You look healthy. You look
I feel
fine.
okay,
You look
but
great.
I feel a little
You just need a little
Once
extra.
in a while it can happen,
little extra shutdown time.
Even
maybe.
to me.
So what's happening at Good Health Natural Foods these days?
Good health. Don't we love good health?
We do love Good Health Natural Foods, of course.
They have a impressive selection of wheat-free foods and supplements. And I don't know if most folks know about it, but it's located in a special section for shopping convenience.
Yep.
And why would people eat wheat-free, Mark?
Well, as Dr.
Allergies?
Hubbock was actually just mentioning a little bit earlier, she was talking about a number of folks out there who have very serious gluten intolerances, wheat allergies. Of course, gluten is the very heavy protein that is within wheat, and a lot of folks really simply don't recognize it. Their bodies don't know what to do with it. They have some very severe problems that develop accordingly. And I think, one of the things that Dr. Hubbock points out is that there's a full range of symptoms and conditions that really can develop. I always tell the story of a woman that I saw just a year ago who was on 3 different antidepressants, and she was really very, very imbalanced. And I found a very severe wheat allergy. So I just said, look, let's kind of start things off real simply here, and let's just kind of subtract, addition through subtraction, as I always like to say. Got her off the wheat products, and within a very short window of time, she went back to her physician. They took her off the antidepressants, and she's been doing fine now. I just talked to her fairly recently, and she's back at work and doing very well. So had a cerebral allergy to wheat. So it can happen. Folks are not used to thinking in these terms, but it's a very real possibility. And I think that, there are many folks, of course, that bear example to that very thing. So, yeah, Good Health Natural Foods is stacked with all kinds of gluten-free, wheat-free options.
Yes, they do. And they also have a nice freezer section, just exclusively for wheat-free. But they also say to avoid rye, spelt, and barley.
True.
As well.
Of course, because those are high in gluten as well.
High in gluten as well. So go by and check them out, and you can learn more about that. They also have some information on their website. It's goodhealthnaturalfood.com, information regarding this. And they also mention the celiac disease,
right,
which is also another gluten intolerance. So if you have food allergies, the best place to go is Good Health to help you
Good
get
Health
the right
Natural
food.
Foods. They are definitely equipped. And Good Health is, of course, stacked with all kinds of really good stuff regarding bodybuilding supplements. Folks, of course, know that they can find their natural antivirals, their monolorins, their lauricidins. They can find their natural antibacterials there as well. Their oregano oils and their beta-glucan, etc. So Good Health is really, it's the South Shore's natural pharmacy for all intents and purposes. And
it's very nice.
Located in 2 very easy access locations. Of course, 1627 Hancock Street in Quincy, 617-773-4925, or 219 Columbia Road, Route 53 in Hanover. 781-826-0808 for all things natural. It is
Good Health Natural Foods.
Yes, indeed.
And they also want to remind folks that they have the natural insect repellent there,
Right.
and sunblock.
Right. They do indeed, and they have a lot of folks right now have serious problems with the poison oak that's out there. A lot of serious skin problems these days, and they have the Highlands poison oak, the homeopathic nosode for poison oak, the Highlands, which works terrifically well, and Good Health does have that. Some folks do well with some of the homeopathic roost tox, for example. They've got all that stuff. So get out and pay them a visit. They'll take good care of you.
Well, you have a seminar coming up on June 11th, Thursday
That's
evening.
Thursday night. Yes,
So
indeed.
exciting.
We've got a lot of folks that have been calling, really interested, and we're going to have a packed house. It's absolutely going to be terrific. And the Red Lion, I don't know if you've been there in recent
they did a
weeks,
great
but
job.
wow, what a beautiful room this is.
Yep.
This is fantastic. It's lovely. So I'm looking forward to doing this presentation on Thursday night, June
Nice
11th this week.
environment.
Yep.
Yep, from 7 to 9. It's called Natural Approaches for the Family.
Yeah, it's natural medicine for the family. We're going to be talking about natural approaches and different thoughts and strategies regarding ADD, ADHD. prostate cancer and PSAs and breast cancer, uterine cancers. We're going to be talking about alternatives for natural antibiotics, natural antivirals. We're going to give some recipes away as well for family recipes from natural foods. Some of them from our website, some from some of the books that I've written, etc. So we're going to really try to make a family type presentation, a little bit of something for mom, dad, the kids, for the whole family, and it really is dedicated to a natural approach to alternative medicine for the whole family.
That's great. If folks are interested in tickets, they're only $20, and you could call 781-383-3393. Santi Holistic Center.
Indeed. We look forward to seeing a lot of folks out there Thursday night. It should be a great night. I see that the weather, I see that 5-day forecast. They're talking about a lovely 75-degree night on Thursday. So come on out, have some fun, and learn a few good things for the family.
That's right. Well, you have a good one.
Yes, you too. Thank you so much.
Thanks.
Take good care of yourself. Have a wonderful night, and get some rest.
I will.
All right.
My spirits are up. I just know I'm coming down a little something.
No, you'll be good as new tomorrow.
I'll fight it off.
You'll fight it off. A good night's sleep will go a long way. We're going to take a short little break. We'll be right back.
Bye-bye.
Oh, Candida, we could make it together. Further from here, girl, the better.
Hi there, this is Mark Mincole, the Natural Health and Healing Show. I know that so many of you out there are passionate about the latest cutting-edge nutritional information, would like to go on to that next level. I'm proud to announce that our new natural health care offices in Cohasset are offering personalized nutritional consultations. At Santi Holistic Healing, you'll experience an informative, individualized nutritional consultation by one of my finest personally trained nutritional experts. Your consultant will test you for specific food allergies and supplements. Together, you will chart out a personalized, optimal nutritional roadmap that will detail your healthiest foods and nutritional supplements, even specific doses. If that's not enough, we also offer relaxing healing massage at Santi Holistic Healing. Whether it's nutritional consulting or healing massage that you're interested in, we at Santi Holistic Healing are prepared to give you the healing experience of a lifetime. Call us at 781-383-3393. That's 781-383-3393 for the healing experience of a lifetime.
Hi, this is Laura from Good Health. Did you know that organic foods offer up to 1,000% more vitamins and minerals than non-organic foods? It's true. So this year, make every dollar count. Shop at Good Health Natural Foods in Quincy and Hanover. See us online at goodhealthnaturalfood.com. Remember, for certified organic produce, natural groceries, vitamins, bodybuilding, herbs, homeopathics, and natural cosmetics, it's Good Health Natural. See you soon.
Alrighty, welcome back, and we're going to get back on point here with Dr. Jean Hubbock. Dr. Hubbock, are you there?
I am.
Terrific. I wanted to get your thoughts on heavy metals. There's an awful lot of folks out there that are finding they have elevated mercury levels. The methylmercury levels are up, and of course, when you're the average American walking about on your average day, if there is such a thing, folks are not having conversation or not really thinking about the fact that they're probably carrying around mercury in their tissues, or lead, or aluminum, or beryllium, or arsenic. Yet, most are. Why, and what do they do about it?
Okay. Well, most of us, particularly those who have lived a number of years, have definitely absorbed it both through the air. There's many tons of mercury that are discharged into the air every year. It gets into the soil. It's into the water and the fish. So the bigger the fish, the more heavy metals that they contain, and the fattier the fish. So the fish that are the most heavily contaminated right now are tuna, swordfish, bluefish, those ones. Mm-hmm. So if you tend to eat a lot of those fish, you could get too much mercury that way.
And mercury is a neurotoxin, a nerve toxin.
Mercury is a neurotoxin. There is no doubt about that one. And there's also mercury composites in the silver fillings that most people who are 40 years and above have been given different silver fillings, often from childhood, and those are 50% mercury. And over time, as one chews on those fillings, there is mercury that is vaporized from that can get into the body. And it gets aggravated if you're a gum chewer or if you clench or grind your teeth, then more of the mercury can come out of the fillings. And depending on the diet, more or less of that mercury then gets absorbed into the body as opposed to moving on through in terms of the bowels and being excreted.
Right.
So that's mercury. Lead was around in terms of lead paint, and recently we found out that it's on a lot of the toys that come from China. So the children are getting exposed to lead just from playing with the toys. And lead is in the soil from the lead paint primarily, and especially in places with older buildings. And we're finding amazing amounts of lead is very common in older people, 50 and up. Most of them will show some levels of lead in their hair. And if you do any type of chelation, which is just something to bind and help excrete the heavy metals, you can see it either in urine or stool. So we know these things are in there.
But you know, it's astounding. I still scratch my head and my wooden head, and I wonder from time to time, what were they thinking of when they were putting mercury in people's teeth?
You know, they really believed that it was inert, that it didn't move, that once it was in there, locked in with the other metals, and the reason mercury is used is that it's so malleable, and it helps other metals be malleable so that they can get them to form into the shapes that they need them to be in. So I think they really believed that it was inert for many years. In fact, there's still dentists that argue that it's inert and that they're totally safe.
So maybe I'm not the one with the wooden head.
No, I don't think so.
You know, I also want to hear what you feel is going on with regards to ADD and ADHD. Of course, there's a lot of families out there. I know that's a hot button, and they want to hear your thoughts on that. So explain, please.
Okay. Well, ADD, ADHD, hyperactivity, attention deficit with or without hyperactivity is very common at this point, and in fact it's being diagnosed in, I think, higher than 1 in 10 in the children at this point. Some of it is definitely hereditary. You can see some of those tendencies often in one or more of the parents, but the huge numbers of the explosion of it, I think, has more to do with, again, a child's total exposure. So by that I mean both what's in their diet, how much sugar is in their diet, particularly corn syrup, how much of the dyes, colors, additives. Some children, those things really make a difference in terms of their ability to pay attention and be calm. And when you start looking at food allergies, additives, sugar, often you can make a huge difference in children just with that piece. And often they don't need medication. They don't need the Ritalin or the different medications that are given to control behavior.
And, you know, the idea of food allergies, of course, you've mentioned that throughout the evening, of course. And I would be remiss if I didn't bring up the whole concept of food allergies regarding GMOs, the genetic modification. Of course, for folks that may not be familiar with what I'm talking about, we're entering into a very frightening period, I say, because they're not even labeling. They're not even labeling. By law, there's no demand for labeling with regards to what is basically amounting to foods that are being spliced. So you've got foods that you are putting down on the table in front of you that look like they're just one singular food, like just a strawberry or just a blueberry. But the genetic modification that's taking place with regards to our foods these days is rather difficult, makes it rather difficult for us to really determine exactly what other foods may be spliced genetically in there. So the whole concept of food allergenesis is entering into a whole new frightening realm. What say you?
Yes, I think you hit upon a really important point, because it's one thing to test a person for a tomato allergy or potato allergy or egg allergy, and then what do you do when you've got another gene that's been spliced onto that tomato in order to make it disease resistant? then maybe they're getting exposed to something totally different, fish, at the same time that they're eating a tomato. It makes it impossible to really, number one, test someone for foods, for a particular food. In other words, when you're feeding one food at a time, or you can have an antigen for one food and do something called provocation neutralization, that technique won't even work if you've got genetically modified foods.
It's going to make
that part
things
is really scary.
It is going to make things quite difficult. Also, that they're actually genetically modifying foods to literally genetically produce their own pesticides from within the seed.
Yeah.
So who
knows what that's going to do?
Who knows what that's going to do? And they're also making seedless genetic modifications so that farmers have to continue to purchase new seeds every year.
Right.
So the whole concept of nature producing a seed and rotating that seed from generation to generation, it will soon be out the window. Because if they have their way, they're just going to have the farm industry have to purchase new seeds each year.
Yeah, I think that would be a disaster. I think that's why some people are really trying to save the heirloom seeds, the ones that haven't been hybridized, so that those seeds do exist.
Of course, you're familiar with H.R. 875 and S. 425. That's the House of Representatives Bill 875 and Senate Bill 425 that was recently written by, for all intents and purposes, Cargill, Tyson, and ADM. And it was lobbied by Monsanto and Democratic Representative, what was her first name? DeLauro. I can't think of her first name, but it'll come to me. But anyway, she is the person who really championed that bill for Monsanto. Of course, her husband is an executive at Monsanto. But what they're looking to do is shut down farmers' markets and make it illegal to grow your own heirloom seeds, folks. So that is still on the back burner in Washington right now, but it's being hidden under the food safety law, if you will. So, Monsanto says, look, we're going to make sure that we own all of the seeds in the world, and that we can account for exactly what they are. Of course, they can't account for what kind of havoc they could wreak down the line, but. It's frightening when you think about what's happening with food, especially someone like yourself, someone like myself. We work with people with food allergies. We've seen what food allergies can do. I mentioned during the last break about a woman who had a very serious depression until she got off the wheat, and suddenly she was no longer depressed. And I know you've worked with many, many folks similarly. So to me, it's really essential that folks get up to speed with what's going on with food quality, because it's slipping away from us. We're losing control over our foods these days. Almost 80% of our foods are genetically modified now. Terrible stuff. Also, I wanted to speak about hormonal imbalances. I know you work with an awful lot of folks, and again, once again, we're seeing a rise in hormonal imbalances.
Yes, we are. And I think one of the big ones is the adrenal, and I think the adrenal fatigue or adrenal stress kind of goes hand in hand with all the stresses of modern living, and how people are trying to, do 3 jobs instead of 1, and
right.
Take care of their families and do everything else at the same time. So we're seeing a lot of people with adrenal fatigue, which can manifest as fatigue, poor stamina, poor resistance to infection, hypoglycemia, those types of things. So that's the first one. The other one would be thyroid. That's often low. That's another one that
well, and the two often go together, of course.
They do.
The adrenals, when you think about the adrenals, they really are pretty much the stress organs, stress glands, I should say, in our body that really drive us into that fight or flight mode and produce all those very powerful hormones that are going to affect virtually everything. It's going to, those hormones will affect the liver, of course. They're going to affect the entire body, including the thyroid. So a lot of folks with very serious thyroid problems because of those adrenal problems.
Yes, they do go hand in hand, and they both have to get looked at.
And, when you work with folks, do you ever see an occasion to use some of the Armour medicines? I know a lot of folks out there are becoming more familiar with some of the Armour thyroids that that were used years ago, and then they were discontinued. They weren't popular for years. Now they're starting to make a bit of a comeback. Do you ever have the occasion to use those?
I do use Armour. I don't use it exclusively, but I do use it. The Armour is a combination of T4, which is the most abundant thyroid hormone, and T3, which is the most active. And usually the prescription medications are only T4. So, and Armour also has T1 and T2, which we're not really sure what it does, but it may be important. So Armour is one option. Sometimes I'll compound the T3, and that's another way to get T3. And I also would treat adrenal and thyroid with both nutritional means, like with thyroid, the iodine is really helpful, and tyrosine, and with the adrenal, vitamin B5, the pantothenic acid, and vitamin C. Sometimes only the first level is needed. Sometimes additional levels of treatment are needed.
Well, and there's an awful lot of folks out there, of course, these days that are dealing with confusing issues that don't seem to make sense to them. I often have people say, how is it that low thyroid and hypertension go together? You know, you think of them as being kind of very different, going in different directions, because hypertension sort of seems to suggest that you're pushing in an overdrive, when in fact you could have low thyroid, which is moving in the other direction, still producing your hypertension. Explain.
Well, hypertension I would see as more kind of moving more toward degeneration and more toward rigidity, and so it's a different mechanism. Whereas with the low thyroid, that can either be autoimmune, it can be deficiency of the necessary ingredients like the iodine and the tyrosine to build it up, or just kind of burnout. So I see them as really very different processes.
But again, you know, maybe a better example, the idea of these unusual sort of pairings. You know, someone, for example, could have low thyroid, but they could be thin. People have a hard time understanding those complexities. Right,
and you can have, you know, adult onset diabetes and be thin.
Right.
So there are definitely different mechanisms going on in those different situations, but they do occur.
I've been talking for the past hour with Dr. Jean Hubbock. She's a medical doctor, family practitioner, and an environmental medicine specialist. 288 Walnut Street, Newton, Massachusetts, 617-965-7770. And I don't know, do you have a website?
I don't, really.
No website. No need for that.
Not yet.
Keep holding out, Dr. Hubbock.
There are some of us old-fashioned people.
Keep holding out. Yeah, I don't blame you one bit. And anything that I did not have the occasion to mention this evening about your practice, about some of the wonderful work you do that you'd like people to know about?
Well, some of the treatments that I offer in the office, one is an infrared sauna. We have one of those in the office that people can use.
Fantastic.
We do the foot baths, which are a detox method. And we do a lot of different intravenous vitamins and nutrients for different conditions, as well as chelation that can be done that way. And there's also a treatment called photooxidation, which is a way of exposing the blood to ultraviolet light, so that it increases the body's ability to fight infection, and it also shifts more oxygen into the red blood cells.
And just talk for a moment, if you would, about the foot baths. I think those are truly remarkable, and I've had a number of folks who really are amazed at that process. Explain that.
Well, I think what it's doing is it's an ionic situation where you're using a little bit of salt water in the bath, and you have a charger there that creates the charge, and so the charge,
it's like an electric charge.
Like an electric charge that moves the lymph, and you actually can excrete through the feet. So it actually is a way to detox the lymph.
In the way people describe it too, Dr. Hubbock, is when they're standing in this electrically charged water that has, you know, the salts in there, that they actually, at the time that they're ready to step out of the water, out of the bath, they see this incredible dark color that filters into the water that came from their body. So they actually see visually this incredible amount of lymphatic detoxification that dumps out into the foot bath, which was clear and bright water when they first stepped in it.
Right.
So it's a you got to see it to believe it kind of thing.
It is an interesting visual. I try not to focus too much on what you can tell by looking at the water, because I think you can read too much into it. But we know that it is moving things, and that's really the purpose.
Well, what is that? Because I've had folks say the color went from crystal clear to absolutely just muddy dark. What is in that water? What gets dumped into that? What gets pulled out of the body?
And what gets pulled out of the body?
In other words, when we're looking at that muddy water, what is it?
Yeah, you're not really looking at heavy metals. Some people say, okay, the black flecks are heavy metals. I don't really think that that's true. Part of it is just the interaction with the metals in the charger that's in the water, creating the charge in the water. I think when you see it really thick and orangish, the deep colors, that's when there's really a lot of detoxification going on.
Right.
When you finish a foot bath and it's still almost clear, you're in pretty good shape.
I mean, are there yeasts? Are there toxins that are environmental? What gets pulled out?
I can't really tell you, and I wouldn't say that it's yeast. And you may be pulling out some heavy metals. There may be some of that coming out because people do use different types of foot pads that can also pull things out through the feet in terms of heavy metals. So I think there is some detoxification.
And you do chelation therapy, biological medicine, and a full spectrum of, again, family practice, environmental medicine. If folks are interested, again, you can contact Dr. Jean Hubbick's office, 617-965-7770, and that's in Newton, Massachusetts. Dr. Hubbick, thank you so much. It's been great to have you on.
Well, thank you so much. It's been interesting.
Love to have you back.
All right. Thanks a lot.
Thank you very much. All right, a very, very interesting practice. Folks want to check it out. No question about it. She's a very remarkable gal. All right, of course, we want to thank Adam Ing for making this visually possible as well as auditorily possible, because you can go onto our website at www.maxhealing.com and you can take a peek at this radio broadcast and any of the other archive shows, or listen if you will. Also, you can check out all my New England cable news segments on there as well. And don't forget, this coming Thursday night, we're going to be at the Red Lion, and that's going to be in Cohasset, Mass. from 7 to 9 this coming Thursday, June 11th. It's going to be all about the family approach to alternative medicine. So it's going to be a great presentation. Anybody interested? 781-383-3393. Love to see you there. Dr. Julie Johnson coming up next. Stay tuned. Until next Sunday, this is Dr. Mark Mincola saying, please be wise, be aware, be well. Make it a healthy week. Good night.
Thank you for joining Mark Mincola for the Natural Health and Healing Show. Call Mark each Sunday.